Hi everybody, my name is Mark. I'm the Senior Osteopath here at ML Therapies, and I'm also a lecturer at the Irish College of Osteopathic Medicine. So one of the questions we get asked when in clinic is why we side shift a neck adjustment from one side and rotate it from the other. And quite simply, it's for safety. So within the neck, we have a couple of structures one structure in particular known as the vertebral artery. So the vertebral artery runs up alongside the neck through the eyelets of the transverse processes. They form a ring. They translate all the way up through the neck, run back at a right angle and enter the magnum foramen to connect to what's known as the circle of Willis. Now, if these get disrupted in any way, shape or form, it can be quite detrimental to the patient's health. And one of the injuries that could potentially be sustained if incorrectly maneuvered is a vertebral artery dissection. So this is what a vertebral artery dissection can look like. It does not necessarily mean that the artery has been actually dissected. It can just mean that it has taken a blow or a hit and can cause thromboses to form inside. So what we do to prevent that, if I was to step a little bit closer, and to exemplify this by my hands, if I use two hands to make an example of two of the eyelets together. So generally what we do is grossly flex the neck. We never extend, strictly because extension can carry an extraordinary extra risk factor for the neck when including a HVT. So we generally grossly flex the neck up to the segment. We intersegmentally flex or extend, generally flex. We side bend and rotate to the opposite side to keep the eyelets relatively in line. Now, if I was to exemplify that with the alternative, which would be actually following the true Fry-Its-Law dysfunction. So if, for example, dysfunction was flexion, side bend right, rotate right, technically we should extend, side bend left, rotate left to adjust. But as you can see, that actually malaligns the eyelets, which can cause a vertebral artery dissection. So for safety, we would flex up to, flex through, side bend to the restriction and rotate to the opposite side to bring it back into alignment so that we have a straight through line and there's little to no risk to the vertebral artery. So bearing that in mind, when it comes to the actual lining up the adjustment for cavitation or for joint release, generally what we do is grossly flex. We add a little bit of flexion through. So if we have side bend right, rotate right dysfunction, we side bend left, rotate right for safety. So if it's primarily a side bend restriction that we have, so if we have to close an opened facet, which is what we use our side shift adjustment for, as previously described in an alternative video, flex up to, so then if it's locked open, we need to close. So we intersegmentally extend, side bend to, rotate and side shift from the side of restriction. So for example, if we have a curvature in this direction, which would be side bend right, we need to side bend left, and that's a translation left to right from the left side. If I was to describe that in a rotation, if we had an extension lesion that closes but doesn't want to open, we need to open it from the opposite side. So what we do is flex up to, flex through, side bend to, rotate to, but this time the rotation is in the opposite direction, and rotate through from the opposite direction. Now, if you look at this diagram here, it explains why. So we have our side bend right, we can see that from here. When our hands place under the patient's neck, we will find the transverse process lower on the right hand side, and that is where we adjust through. Now, because we are rotating left, we have to have an opposite side bend. So we actually flex up, we would side bend right, rotate left, because rotation is what we're finishing through the adjustment with, and cavitate through from rotation to lock open the closed facet on the near side. So again, what we do generally is we open a closed facet with a rotation, and we close an open facet with a side shift. These for safety are done from opposite sides, and again, as we can see on our side bend with this direction, this direction, translating from this side to that, we then on the right hand side would have to uplift or rotate left from the opposite side. So there you have it, guys. We've just gone through a quick run through on why we side shift versus rotate from opposite directions. If you have any questions, give us a shout. If you like what you see, hit like and subscribe, and thanks for watching, guys.